Good afternoon, everybody. Thank you for joining us for this afternoon's COVID-19 Professional Education Quick-N-R. My name is Matt McDonough, and on behalf of the ESRD NCC, I would like to welcome you to this afternoon's event. Before we get started, I do want to take a moment and let you know that today's event is being recorded and that these recordings are typically published to our website, esrdncc.org, within about 3 business days, but we're a lot quicker than that. So be sure to check out the slides and the recording of the event after today's event has concluded. So let's jump right into our agenda and talk a little bit about how our call will go today. We'll talk a little bit about what this call or this series of calls is about. I will then turn things over to today's speaker. You can see a little bit of information about her on the screen now. And then at the conclusion of our event, we will look at our chat panels, we'll look at our Q&A panels, and we will answer as many questions as we can that you submit via those 2 panels. So at any point during the course of today's event, if you do have a question, feel free to type that question into the Q&A panel or the chat panel, and as time allows, we will get to as many questions as we can this afternoon. So a quick note about what this call or this series of calls is all about. These 30-minute weekly opportunities are a chance for professionals and stakeholders in the community to hear from other professionals and stakeholders who are adapting to COVID-19. Now, the COVID-19 situation is obviously evolving pretty rapidly, and as this evolution takes place, our speakers are sharing their experiences on how they are coping with not only what's come in the past, but what's to come in the future. And through these conversations, we hope to provide some real-world strategies that your facility or your organization can hopefully put into use. So it gives me great pleasure today to introduce Barbara Ballack, who is the co-founder of Afina Partners. She's a senior faculty at the Institute for Healthcare Improvement and a former member of the National Patient Safety Foundation Board of Advisors and faculty for Arizona State University's Executive Fellowship in Innovation Health Leadership. Using a human-centered co-design approach, Barbara works with healthcare leaders to generate flourishing cultures and exceptional outcomes by integrating patient and family experience, quality, safety, and joy in work. Recent activities with leaders include developing skills and systems for patient and family partnerships in physician practices, culture strengthening that enhances joy in work while improving safety and reducing burnout, physician leadership development, systems that assure reliable transitions in care, and effective infrastructure design for population health. It is my great pleasure to introduce and to turn the floor over to Barbara Ballack.
Thank you so much, Matt. I appreciate the intro. Hello, everyone. Glad to be with you, and just a wonderful group to be with. I have a personal attachment to those of you who do this work. My father benefited from your care and in the past, and so I'm very grateful for that. So if we could just advance to the next slide and we'll get going. Before I get into the what and then the how we do work around psychological safety, I want to talk about the why. Why is it important, and especially why now? Why is it important? Those of you who know, have spent time studying safety science are very well versed in psychological safety. In the past, we may have talked about it in terms of the ability to speak up, the ability to question, the ability to ask our colleagues, is this the right step to take? We know through lots of years of study that that approach, that belief that I can speak up makes for safer care for both patients and for those who are providing that care. The second thing we know from lots of studies is that it builds better teams. It's the foundation for teamwork. The third thing we know in my most recent work, as was mentioned, is with the Institute for Healthcare Improvement on joy in work. And we know that in the white paper, free download, and it's cited here, that we have 9 domains that we pulled from the literature and from the field that really contribute to joy and meaning in work. And the key, one of the key elements I would put it as the number one element, is both physical and psychological safety. And that definitely leads us to the, well, then why now? Because never before, I think, have we paid this much attention to both physical and psychological safety in our care environments. And it includes whether you are caring for patients who have or have been exposed to the virus, or you're dealing at the other end of the spectrum with colleagues or team members who are at risk of losing their positions, even temporarily. It's a very unsettled time, very bizarre time, I think, for all of us. So it's one of those environments that if we create this, it can serve us in multiple arenas of our work as leaders in complex work. And I'm always looking, all of us are way too busy. I'm always looking for things, one set of actions that leads to improvement in multiple areas, and this is it. And I'd like to quote my colleague Jessica Perlow, who is the lead author on a white paper we did for Joy in Work, is that these are also times that we need our psychological PPE as well as our physical PPE. So building psychological safety in your scope of work builds that psychological PPE and hopefully reduces the chance of ongoing or long-term personal distress as a result of what we're going through. So definition you can see here, I really admire the work of Dr. Amy Edmondson. She's a researcher and faculty member at Harvard and has done an extensive amount of work with healthcare. I got to know her through my work with the National Patient Safety Foundation, which is now part of the Institute for Healthcare Improvement. Her work stands on the shoulders of Edgar Schein, and he's also cited there, who's one of the early leaders in organizational culture and what it means. And he first coined the term, and Amy has built on it through her studies. The book Teaming, I cite here, and on a future slide, you'll see another more recent book, Fearless. I recommend both of them highly, and I know that's tough to do, to recommend to busy professionals in the midst of a pandemic, but just for future reflection and use. So psychological safety is the belief that we won't be humiliated or punished for speaking up. And whether it's outspoken, well, that was a stupid idea kind of comment, or the silence or the eye rolls that sometimes happens in our work environments. It also means that we feel secure and capable of changing. People who experience psychological safety are more willing to step forward and say, well, I'll try that, because they're not afraid of looking silly or inexperienced. When psychological safety is missing, there's this great fear of not looking good. There's more concern about looking good than doing good sometimes. We know through studies that the reluctance to speak up is enormously high in our care settings. And what that does then is free us to focus on common goals and problem prevention, not self-protection. So that's where we get the creativity and the energy. And what we need right now is people who are willing to step forward and say, sure, I can try that. I can try something different. I know of many colleagues who have been, for instance, nurse leaders, nurse case managers, nursing members of the clinic team, the outpatient team, who've been asked, as their volume has reduced in their health system, to move into inpatient acute care. They're working in med-surg units, so those med-surg unit nurses can work in the ICU. That takes a lot of psychological safety to be able to step forward and do that. And another note about psychological safety, it's a team characteristic. It's not an attribute of individuals. So it's not the sort of thing a leader can say, well, if people would just step up and feel psychologically safe, it would all be better. No, it's something we build together as a team. And just a few team members can really erode it. And maybe some of you can picture that person in your mind right now. It's consistent, as I mentioned, with exemplar safety environments, and it's critical to be able to have psychological safety, to have an effective learning system. And that's definitely what we need now, to learn quickly and to move things forward as we need to adapt and change. So that's the why and what is it. Let's get into what do leadership behaviors look like. So if we could get the next slide, please. There's really 5. These can be lumped together. I'm a lumper, so I could probably get these down into 2. I follow Amy Edmondson on Twitter. You often find very small, little short snippets of her wisdom there. It's a great way to get, I call them just little bite-sized doses of her wisdom. And there's the other book, The Fearless Organization, that I had mentioned earlier. So the first behavior is frame the work. Make it normal for people to understand and continually remind people this is really complex work. Even in the best of days, minus a pandemic, healthcare is incredibly complex work. And when I think of the complexity of the people you serve, it's mind-boggling. So being able to remind people, now, this is really complicated stuff. So remember, let's all pool our wisdom. Let's all work together because no one person has all the answers. One of the common phrases I like in my past safety work is never worry alone. If you're worried or have a question about something, it means that's worth speaking up about. Because no one has all the information. And when somebody does worry out loud and share that concern, that's cause for success and recognition. So here's a few examples of being clear on how complex the work is and how important the purpose of the work is. We are here to serve some of the most complex people in our community. No one knows everything, so we've got to be willing to work together. As a leader, be willing to show your human weaknesses. I make mistakes. We all fail. That's part of working together as a team. We help each other out. We pick each other up. We act as a buffer when we're missing things. I clearly remember a med student way back when I was a new grad. And this tells you how long ago this was. It was before we had reliable pumps for IVs. And so we would have just an IV bag and we'd count the drops. And we were taking care of a very complex woman. It was an ICU type of situation. And get that, I was a new grad. And behind me was a med student, and I still can feel his arm reaching over my shoulder to adjust the drip on that IV. And he just quietly saying, "I bet you didn't mean to have it go quite that fast." Well, here it was in a free flow. I had missed that. He saved me, and more importantly, he saved that patient. So we all fail. We all make those mistakes. And then when we do have errors or mistakes, highlight them as learning opportunities. Okay, what are we going to learn? That didn't work as we expected. What are we going to learn from this? So it normalizes that. The second big area is be accessible and approachable. And I always say you can't be accessible and approachable when you're not in contact with others. And today we may be doing more of that virtually than face-to-face. However you do it, make sure you make time to be accessible and approachable, and especially now when there's so much tension in our work environments. So you're able to encourage team members to learn together by being personally involved. So asking, well, Sue, what did you learn today that we should pay attention to, that it was a new discovery that we should learn from? So spending time with people, asking them what's important to them right now. In our work on Joy in Work, asking people what matters to them. And we have a learning network going on right now that I do a little bit of work with on Joy in Work. And asking people what's important to them right now. You may hear something about what's going on at home. You may hear something that you should know about at work. All of those things helps us to mobilize together as a group. Third is to invite participation. I'm a huge fan of co-design. That means that those who are closest to the work often have the best ideas. So constantly seeking ideas from them. Saying, how have we worked on these complex issues before? What have we tried before that might apply here? What have you learned in other situations? You may have new team members working with you, so you can ask them, well, where you were before, what was a similar situation that we might be able to learn from? We know that team members are more engaged when they believe leaders value their ideas. The whole theme about psychological safety is that all voices are heard and respected. So how are you making sure you're hearing all the voices, not just those who like to speak up? And again, we have our more vocally negative colleagues, and we have folks who just love to speak up. And then we have our quieter colleagues, or those who don't seem to feel they have as much power in the hierarchy. How are you learning from them? So structuring opportunities for them to be involved and heard. So those are the first three. Let's move to the final two behaviors, and then I'll just give a few examples and we'll open up for conversation. So the final two are use direct language. Sometimes when things are really complex and complicated, we use jargon. The new syndrome we're seeing in children that seems to be a complication of COVID. What is it? It's a multi-system inflammatory, et cetera, et cetera. It's 4 words, 4 long words. And my husband has heard me say this a lot, that when we don't know exactly what something is, we assign it a very long name in healthcare. So we often do that with complex situations. So use clear language, avoid jargon, and I love the term, be respectfully blunt. And so if it's sucky, say things are sucky, whatever term you feel comfortable with. But saying, you know, this is really a crummy day today. Let's see how we can make it better right now. What can we test right now? People appreciate the directness and the honesty behind that, and also the spirit of we're going to make this better together. And then the fifth one is be clear on standards. Amy Edmondson has some marvelous publications on what psychological safety is not. And psychological safety is not that you can say or do anything you plain old choose. Your standards of respectful behavior still apply. So treating each other with respect and dignity is part of psychological safety. So you can't be psychologically safe in one part of your work and walk down the hall and experience something different. So setting boundaries and holding others accountable for violating them. So you might say to a colleague, someone you're seeing, a team member, and you might take them aside and say, I know there's a lot of stress right now. Let's see if we can find a better way for you to talk out that stress than taking it out on your colleagues. Here's what I saw that didn't help you or them. So being clear about that, co-develop those standards of behavior to be clear about what's acceptable. So even if you have a couple of minutes in a brief huddle and you don't have these standards, you can say, how do we want to describe how we treat each other in this department? What does that look like? And again, this is where you tie it into no jargon. So if part of your standard is to be respectful, could you give a few examples of what that looks like? And then, as I mentioned earlier, coach people when they fail to meet acceptable behaviors. And you probably have lots of occasions right now to coach people because of the stress underway. So next slide, I just have a few examples. I won't walk through them, but they're there for your use, ones that others have shared, ones that I've seen, one that I've used. So things like what's troubling you about this patient? What should we worry about? Asking each other what questions you might want to ask. So that's some of the why, a bit of the what, and some of the how with psychological safety. It's skills we build over time. People, just because you work on it a few days, a week, or several months, doesn't mean you're automatically going to have psychological safety. Lots of our folks who've worked in healthcare for a long time have been well enculturated in very unpsychologically safe environments. So it's not going to happen overnight, but you can make profound difference in a short period of time by just building on some of these. So maybe tomorrow, start one of these activities, ask one of these questions, and use one of the behaviors and see if you can see some difference in those you interact with. So I'll stop there and welcome questions, concerns, experiences you've had in doing this.
Hi, Barbara. Before we did receive a few questions, and we would like to open the floor up again to if you'd like to submit your questions as we begin to answer them, please do use the chat panel or the Q&A panel. We are monitoring the chat and Q&A panels and would love to have an opportunity to have your question answered today. So Barbara, let me go ahead and ask this first one that we got. you mentioned psychological PPE,
Mhm.
there's not a lot of background on this question, but it sounds like this is someone who has now gone from a bad situation or a less open situation into one that is more open. What are some things that they can do to train themselves to be in that mindset, to know that they have that security and kind of reduce the it's an inherently timid nature is what it sounds like.
Yeah, what a great question. I think that's a really profound question because, as I mentioned, we're all enculturated, so we kind of guard ourselves against speaking up and against sharing information. So wonderful behavior to think about, which is what can you test tomorrow that helps you build some of that confidence that the new situation you're in has more psychological safety than what you've experienced in the past. So it may be, if you have a question, we all have questions every day we work. I mean, you do. So maybe ask a question of either a leader or a colleague and say, how do you do things here? I'm about to do X. Is there something I should know from how you like to do things here? So perhaps posing a question. Seeing, in the past when I've tried to speak up when I see somebody doing something that makes me nervous, that hasn't been well received. How do you guys do that here? So leaving it open, not judgmental about, boy, I see you guys do things differently. Just saying, how do you like to do it here? And does that help answer your question a bit? Because I think that's a very intriguing one.
It is, and it does. I believe that does help, and it kind of leads into our next question, and it's actually the inverse of what we just talked about. This person is a new transfer into a facility who came from an environment where they were very open, and their question is, how can a staff member motivate leaders, and I guess even maybe hint to leaders that would make an environment more psychologically safe?
Okay. Yes, very good example because we can influence from any point in the hierarchy, whatever our role is. A couple of things. If you have a conversation with a leader, you could share some of these slides. Say, I heard some of this content yesterday. It's really well researched. And I think it's something we could work on together here. And you could understand that person may feel a little bit defensive, like, well, aren't we safe here? So you could say, maybe if you have a positive example, building on the positive example that you've seen, and saying, the more we do this, look at how much better this makes organizations from what I've been learning from these resources. You could also talk to a couple of team members that you think might get it about psychological safety and maybe start with them. So maybe your request is, here's what I learned yesterday. Just give them a few bite-sized portions of it and say, what I'd like to ask from you is if you ever see me coming close to making an error or doing something I shouldn't be doing, would you stop me? And I promise that I will thank you for doing that. So you invite people in to your secure space, and you invite them into helping you be safe and helping them be psychologically safe. So those are a couple of examples I think of.
Absolutely, absolutely. And as we were speaking about that, another question came in, and a lot of this comes into how different individuals in leadership interpret these types of approaches. And this question says, in much of my experience, if they bring up a problem or an issue to a supervisor, that reaction is that they're a complainer, or they're a troublemaker, or they're causing the problem. And as you just said, how do they let people know that they're trying to help and be part of a team and a solution?
Exactly. And I feel badly for people who are working in situations where that's what they feel, because those problems are bound to persist even more than if there is a psychologically safe environment. Problems get solved in psychological safety. So a couple of things is you could lead off testing a few approaches saying, here's an issue that I've seen, and I'm really interested in working on it. So right away, you're making a statement that you're very interested in working on it. So it's not just sometimes people will bring problems to leaders and kind of dump it on the floor in front of them. I call it a dump and run. So here it is. Check back with me when you've got it fixed. So it's, I want to be part of the solution. I'm just stuck. I don't know how to do that. And I figured you had more information and knowledge about this than I did. So I think saying you want to be part of the solution is a key part. Testing that, it may not change right away, especially leaders like all of us get into our own habits. And so right now I think leaders are feeling overburdened with lots of problems to fix. So having a team member say, I'd like to be part of the solution of this is a great way to start.
I think that's spot on in terms of leading with the constructive lessons that potential misinterpretation. So great, thank you for that very much. One more observation, and I'm going to phrase this as a question, but it came in as more of an observation, was some of these suggestions seemingly could be used during the interdisciplinary plan of care discussion with patients to help guide the overall discussion and potentially empower patients. Are you aware of any situations where that's happened that you can share?
Absolutely. Anyone who's doing interdisciplinary rounds that actively involve patients, or if you're doing change of shift or change of caregivers at the bedside or at the chair, wherever you're doing it, are probably practicing some of these. So who's ever leading the rounds, sometimes prompting them, or if you're a team member, inviting people to comment. Who has some questions, inviting the patient. We've been talking a lot. What's your thoughts about what's going on? Avoid yes or no questions. Invite them into the space. Sometimes people might say, well, I don't have any questions. So saying things like, I'm sure you have some questions about what we're talking about, and we desperately need to hear from you so that we can do the best care together. You're part of this team. Also inviting other team members who may not speak up as much. So I think one of the quotes is, well, Lucy, we haven't heard from you about Alan's care. Alan here said he had a question about X, Y, or Z. What's your thought about that? So the talking should be amongst everybody. So open and honest questions you don't know the answer to. Avoid yes, no questions. Are really a very positive contribution to those interprofessional, interdisciplinary rounds. And a large number of facilities have been using those well. So pay attention to people who do really well with patient and family-centered care. They've probably got a lot of that going on. Patients are highly susceptible to lack of psychological safety. You probably remember the Joint Commission campaign they had several years ago on Speak Up. There were even speak up buttons. And I heard a number of stories of elders thinking they were supposed to talk louder to others. That's why they were wearing the button. So we have good intent, but sometimes we don't take the steps needed.
Right. Well, Barbara, this has been incredibly engaging and informative, and I just want to take this time to say thank you for joining us this afternoon. We actually have gotten through all of our questions, so it seems to be a perfect time here to...
just one last closing comment. Sure. I forgot to include my email address on the slides, so if you want to share my email address, I welcome questions. And usually, and I always get insights from others, so I would definitely welcome that.
Wonderful. We will make sure that we share that out with everybody. Thank you so much again, and we appreciate your time this afternoon.
Well, thank you. Have a great rest of the week, everyone.
You too. Thank you. We'll go ahead and get into our wrap-up here. Before we do that, we just want to remind you about the kidneyhub.org. This is a new resource for patients and professionals. It's designed by subject matter experts that participated with the NCC to design this tool that focuses on tools and resources that are most important to patients. It includes resources such as COVID-19, transplant, well-being, and it is being enhanced all the time. So we invite you, if you have not yet done so, please go out and check out thekidneyhub.org and see what is out there and available for you to access. Let's talk a little bit about our next Quicken-R events. Please save the dates for these events. These events are actually out on our website right now for registration. That website, as you can see, is www.kidneycovidinfocenter.com. You can find information on both of these events and sign up for them. Our next patient-focused event is May 26th. That is a Tuesday at 5 p.m. Eastern Time. And our next provider-focused event is 1 week from tonight. That's May 27th, 2020 at 5 p.m. Eastern Time. So again, check out our website, www.kidneycovidinfocenter.com, for more information on both of these sessions. And that's going to bring us to our final slide. On behalf of the NCC, I just want to say thank you for attending and for your questions this afternoon, and a special thanks again to Barbara. Our contact information is here on the screen if you'd like to get in touch with us. In addition to our own website, which we've already talked about, you can see it on the lower right of your screen here, the CASERcoalition.com website has additional COVID-19 resources for both patients and providers. So we encourage you to check both of those resources out. Again, on behalf of the NCC, thank you for your time and attention tonight, and we will see you on a future event. Have a great evening.